Hey, so I get asked questions a lot about laser therapy. What is it? What can it help? All that kind of stuff. So I thought I would go through this briefly. So what is laser therapy? Laser therapy is a form of light therapy. Okay, another word for it is photobiomodulation. Literally, we're using light to modulate the biologic processes. We use specific wavelengths, frequencies that interact with our cells to accelerate healing, reduce pain, inflammation, improve circulation. Different types of lasers. There's cold lasers, hot lasers. I have both in my clinic. I use them for different things. So how does laser work? The light that we're shining on, on the skin and it's penetrating in, it's absorbed by the cells and turned into energy. It's kind of like they got little solar panels on them. They then use that energy to repair, heal themselves, whatever process they're trying to do, then they have more energy to do it. And so basically we're just increasing what we call ATP, which is the energy for the cell. So then I get asked, is this just red light therapy? It is a type of red light therapy. Most people, when they're asking red light therapy, they're thinking of the things they've seen on Amazon or on Facebook or whatever. Those are generally LED, and LED has its place. I have some LED devices that I really like that I keep at home for when I need something. Usually with LED, you need to get a more powerful device than, if you compare one-to-one with laser, a less powerful laser will be more effective than a LED around the same range. So you got to get a stronger LED, but they do have their place. Laser therapy can also be different colors. I've had lasers anywhere from blue to violet, I guess, and then green, red, infrared, different types. So it's more than just red light therapy. Now, who can benefit from laser therapy? Everyone is what I always say, but specifically in the clinic, we use it for chronic pain. We use it for joint issues, inflammation anywhere, even like gut issues. A lot of times I'll be lasering people's gut for an inflammatory condition to help them with digestion, things like that. TBI, concussion, I use it on every single concussion case that walks in. We put the laser where the damage is in the brain or the brain stem, things like that. Neurologic issues, so like the brain rehab we do with like ADHD, anxiety, depression, things like that, where when we're not treating those things, but the laser can help give the brain some more energy, so we use it for that. Wound healing, it also works really well. And there's others. There's people who use laser for the thyroid, autoimmune conditions. There's a lot of good research on that. You got to use a low powered laser for that, but it works really well. So there's lots you can use laser for. What's the process like? Generally, it's very comfortable. A lot of times, depending on the laser, you won't even feel it. We're just shining the light. It's low powered enough that you won't feel any warmth or anything. But if we're using the higher powered lasers, you will feel warmth. Generally feels pretty good as you're doing it. It doesn't, as long as we keep it moving, it doesn't get too hot. The warmth isn't what is healing. That's just an effect of the higher powered lasers. The healing effect is from the light itself, the photobiomodulation. So how many treatments will I need and how often? Depends on the person, right? Younger person, usually we're going to use less because they'll heal quicker than someone that's older. But acute injuries, we're usually 4 to 6 sessions, somewhere around there, sometimes less. Chronic conditions will take a little more, in that 5 to 10 range. And then like neuropathy, for example, we have a neuropathy program and we start with 16 sessions. And usually we go 16 sessions and we've reached the maximum improvement on that person. And so, but sometimes we go a couple more. And usually when we're doing laser, we want to do a couple a week at least. It kind of builds on itself. So sometimes I have people come in 3 times a week. But usually, 2 to 3 works. The sooner we do it, the quicker the healing happens. So, what are side effects? There's not really many side effects of laser therapy. It can temporarily increase the pain, just as we're stimulating things. Sometimes that happens. And then, sometimes the skin will get a little irritated. But usually there's not really, any risks of laser therapy typically, or side effects. Now, what are the risks? Eye injury. So we don't laser over the eyes. Often we'll have you wear glasses depending on where we're lasering, just to protect the eyes. As long as we're being smart with how we're applying it, this is not a big risk. And then with the hot laser, there is a risk of burn. But again, as long as we're applying it like we're supposed to and keeping it moving and checking in with the patient, we've never had that happen. So the risks are very low. Who shouldn't get laser therapy? The list is fairly small, but there are a few: cancer in the area or cancer that is spread. We want to avoid laser. Laser might increase the cancer growth. So, if someone has cancer that's limited to a certain area, then maybe some laser therapy could be done, but that's a conversation we'd have to have with them. Pregnancy is not a complete contraindication. We don't laser over the belly. We don't use the higher powered lasers generally, at least not on the back. And that I will use a lower powered laser. But again, it's a conversation we have with the woman. If someone's photosensitive, obviously light therapy may not be for them. And then pacemakers, we don't laser over a pacemaker. Other implants we try to avoid. If it's a joint replacement, we can laser over that. But if it's an electronic, we don't want to laser over it. We can laser, in other areas, but just not right over it. So, and then I get asked, how much does it cost? Usually it's $50 per session, except for neuropathy. Neuropathy is a different case in that we have to, the neuropathy treatments just take longer. We laser the back and the entire leg, each limb from about the hip or the knee down. And so it takes about 25-30 minutes. So the neuropathy ones end up being a bit more, and we do a neuropathy package for that. But usually you're $50. If you do it with another treatment, we just tack on, I think it's 20 or 25. So we do combo it that way. If you come in for an adjustment and laser, it's like $70 or $75. So I've kept it fairly inexpensive. These devices are not cheap, but they are very effective at pain. Ozone and laser, I always say, are the two things that I found that heal the fastest. Nothing else comes close, in my opinion. And so, if you have any other questions about laser, please let me know. It works really well on all kinds of conditions, especially pain. I love working on like knee pain and things like that with laser, arthritis, stuff like that. It works really, really well. Usually people notice a difference right away. So hope that's helpful. Thanks.